I started as an engineer mainly because I knew I was good at math and science. I wanted to take everything that I learned in engineering and how the forces are applied to the body and manipulate that through my own hands or through exercise or mobilization so that I can benefit those patients. That was really where most of my interests started to become more focused. Got my master's in biomechanics engineering, but at the end of that time realized that I didn't want to do engineering. I chose physical therapy because it fit more of what I wanted to do as a career. I chose Columbia because it was really the best fit for who I was as a person. I was always a very dedicated and hard worker. I knew that I always wanted to be around other people who were going to drive me the same as I would drive them. My primary role is to really treat patients. Recently came across a patient who had a very interesting presentation and decided to write an article on it, and it was recently published into the Journal of Orthopedic and Sports Physical Therapy. Whenever an interesting case comes across like that and I have time to write an article like that, I will do so, because part of, I think, what we do is not only educate patients, but also educate our colleagues as to some of the other things that are not so typical. What I also do is teach in the program on a part-time basis. So I will get involved in some of their core curriculum classes from the first semester that they're here all the way through until they graduate. Primarily in the courses that involve the musculoskeletal system, because my specialty is in orthopedics. I love doing that. As you know, the students need to get their clinical affiliations and their internships all done. And one of the best ways that we like to promote the program is by sending them to some of our alumni. I think that we're going to really expand uniting our current students with our alumni so that we can build a better relationship from those who've graduated to those who come through the program now or in the future. I take continuing education at least twice a year, sometimes more, and not just because we're required to by the state, but more so for my own knowledge. One of my favorite reasons of why I chose physical therapy was that it was more of a career where you never stop learning. I think that one of the best things the curriculum at Columbia provides is a chance to go into the specialty tracks in your last year, whether that be in orthopedics, neurology, pediatrics, etc. But taking the advantage of going through those advanced tracks allows you to focus on the profession that you are really interested in doing as your career going forward. You're going to have some of the best relationships not only with your classmates and your colleagues, but with those faculty members and alumni that you will meet. That relationship will take you to many, many horizons. And I think that if you are open-minded enough to see how well that will prepare you for the future and what connections it might lead you to, then you're going to be a great candidate for Columbia University. My name is Rami, and I am a Columbia physical therapist.